Hi, everybody. Welcome to another edition of OnOshkosh. I'm your host, Cheryl Hentz. Very happy to have you guys along with us, and very happy to welcome back an old friend to the show. Oshkosh Fire Chief Mike Stanley is joining us tonight, and we've got a full-packed show. It's just the two of us, but it's jam-packed with information, so you're going to want to probably have a pen and paper handy because we're going to be giving out some websites. And it's some good information for you too. So welcome. Thanks for being here.
Thanks, Cheryl. I always appreciate the invite and look forward to the opportunity to spend some time with you and be on the show.
Yeah. And we were just talking before we started rolling here that I don't know if I'm going to have a chance to have you back before Fire Prevention Month and Fire Prevention Week in October. So if we have some time before we wrap things up tonight, we'll talk about some of those things too. But
perfect.
The first thing we want to talk about, you guys have been very involved in fall prevention, fall reduction, that kind of thing for I think several years now, probably, but most recently in the last few years. And I just want to throw some statistics out there. 1 in 3 people between 60 and 65 years of age or older experiences at least one fall in their lifetime. I've fallen a few more times than that. I think I fell before I even hit 60s, but falls make up about 18% of 911 related ambulance runs, at least in 2022, according to the CDC. This is what's interesting to me, is that Wisconsin has the highest fall rate death among adults in the nation.
Correct.
That's scary. And of course, as the number of falls and fatal falls increases, we need to do more and more to address the situation and try and get these numbers under control. Why do you think that Wisconsin, or why do we, if you know, why do we have such a high rate of falls?
A lot of it, the cause for falls and the cause of that increase in number of falls is because the population is aging. We're experiencing what many people call the silver tsunami. Right? That, and as Oshkosh and Wisconsin, very desirable place to retire. I think that's
really.
Yeah. So surprisingly,
I find that surprising.
That people want to go to Florida and the beaches, but when you look at income tax levels, cost of living, resources and services, that very affordable, very desirable option, for a lot of retirees. So Oshkosh is typically listed as one of the best places to retire in some of the national surveys and things. So I think we draw, a population of, have an influx of population of retirees, in addition to the people that live here now that are
Sure.
aging. Then you look at some of the comorbidities that maybe be common, maybe as a result of drinking, smoking cigarettes, diabetes, things like that. That the high rates of that can certainly contribute. Just based on local experience. You think about a lot of the construction types that our housing has. Cellar and basement stairs. That are old, small, narrow, aging banisters. Things like that. That is that contributing to those falls as well.
Yeah, those things are interesting. And then, of course, a lot of people, and I don't think that this is unique for us here in Wisconsin, but a lot of elderly folks, they have a pet. And sometimes, pets don't mean to, but sometimes, boy, they just get underfoot, and down we go. And, we've got graphics up on the screen, guys. We don't need those credits, but please change them. That's one thing I forgot.
Show's over.
Yes, we're all done.
Thanks, Cheryl.
Boy, that went fast.
Yeah.
Wow. But in any event, pets don't mean to get underfoot, but sometimes they do. And sometimes we trip over them even though they're trying to stay out of our way. Rugs are also trip hazards, things like that. Before we talk about this app that I've kind of been promoting on a few shows recently, but are there Is there something with the fire department? I know the county will come out, I think, and the county health department will come out and sort of like evaluate your home for fall hazards, trip hazards, stuff like that. Does the fire department do anything like that?
The fire department doesn't conduct it. That we've got a variety of community partners that offer a myriad of services, and I just brought you a brochure that's hot off the presses that we've put together. We just got those yesterday.
That's great.
That talks about the different resources we have. So we have a number of different partners that are skilled and trained to do those assessments. So public health, Winnebago County Public Health is one. The ADRC will do that. Rebuilding Together will do that. Come in and evaluate, and place home modifications like grab bars. So we've really worked hard as a coalition to find lots of different available resources. And for the benefit of the viewers that aren't looking at the brochure, the way we can get you to these resources. In the last year, we've partnered with 211.
Okay.
So they are our gateway. That's the top of the funnel. That if you call 211 and talk about, you have concerns about falling, you're at risk of falling, or you have fallen. We also have a referral program for people we see that fall. That's the first portal of entry is 211, and then they can help make referrals to these different services and help get you scheduled, make sure you're followed up to get those things done.
Yeah. You mentioned about Rebuilding Together Fox Valley. I would love to have these people come on the show, and if someone from there is watching, please reach out to me. I have called these folks, and I have emailed them, and I've left them messages, and they've never bothered getting back in touch. And so I found that kind of discouraging, but I do know that they do some free home modifications if you're income qualified. And so 211, I guess that's a good place to start, and then that can you can get sort of funneled out through there.
Well, and I'll address that tomorrow morning. Then I work very closely with their executive director, so we can go right to the top. And
excellent.
I'm pretty confident that he'll want to take you up on that opportunity to be on the show, and so I will connect you two and follow up with him in the morning. How's that sound?
That sounds wonderful. I appreciate that. Yeah, I still have, when they very first started a few years ago, I was given one of their flyers by someone here at Oshkosh Media, in fact. And he said, hey, this might be a good guest for you. I tried, and just to no avail. So, yes, I would appreciate that. Thank you very much.
Yeah, you'll love it. His real name is Chip Wood. For Rebuilding Together. So,
oh my God, that's funny.
Yeah, wonderful guy.
And that's not a fake name. That's
nope, he's saying that's how he starts his introductions. It's my real name.
Wow. All right, well, Chip Wood, I hope to hear from you. So the good news is about falls is that they are preventable. And, I don't know if they're all preventable, but we can certainly take a big bite out of the numbers that we're seeing. And medications too. The older we get, the more medications a lot of people are on. And, some of the side effects for a lot of the meds today, even for younger folks, is, don't operate heavy machinery, don't drink alcohol when you're using this medication, so on and so forth. Because it can, certainly if you're taking those things as well as the medications, you're probably going to have some problems. But just a new medication being introduced in your system, it can cause you to become a little dizzy or a little disoriented. I know I started on a new medication at one time, and all I did was turn from the kitchen sink to the stove. And I felt so dizzy, like I was almost going to fall down. Well, I just grabbed, the counter and the stove and balanced myself, steadied myself. But, it can happen that fast.
Absolutely.
And so, but there is a new thing out here. It's a new app, and I've been talking about it. I talked about it recently when the folks from the county the public health department were on, and I've talked about it a couple other times as well. And it's called Nimble, NYMBL. So N as in Nancy, Y, M as in Mary, BL. That's the name of the app. And talk to us about what this app is. Is this something unique for us here in Wisconsin?
It is that we are the first organization in Wisconsin to have this. That we introduced it into Wisconsin. We're one of very few fire departments in the country that has had the opportunity to implement this Nimble app. And part of the reasoning behind that is, we really want to have a myriad of resources for people. One of the things we consistently find with elderly adults is isolation and transportation issues. That while there's a host of programs, available at fitness centers, the YMCA, the senior center, if you can't leave the house and you have transportation issues, if I can't make it every Tuesday and Thursday, we want something you could do from your home.
Sure.
So phone, tablet, device compatible, that 10 minutes a day, makes a huge difference. That, it's a fun, interactive application that causes you to have some physical movement, but it's also paired with, cognitive tests or cognitive exercises that are fun. So you can play trivia, you can play a matching game, a memory game. You choose what you want to do, but the research has shown that pairing of the cognitive stimulation along with the physical movements not only increases balance but also helps with memory.
Sure.
Sure. So really viewed it as a great opportunity. We first were exposed to this application. The research that they've done, and the results we're finding here in Oshkosh since we've implemented are really fantastic. So we feel very fortunate that we're able to offer this in our community.
All right. So I guess I was not aware that this was a Oshkosh unique thing. I mean, I knew that you guys were heavily promoting it, but I didn't realize that that's one of the reasons why. So I think that's great, and that's very commendable for you guys. And so it's I love these sites on TV where they say, oh, download it for free. And then you download it. Sure, you can download anything for free, but then you got to pay for things quite frequently. This is not something that you have to pay for, whether to download it or to use it. It is totally free. And if you don't have a smartphone, or you would prefer not to use a smartphone for this, there is a website that you can go to and you can enroll that way. And we've got that address up on the screen right now. If people are listening to us on the radio, it is enroll.nimble, NYMBL science.com. And we'll have that up a few more times. So you kind of talked a little bit about what it is, what it does. Is there, you have to be a certain age to use this though, right?
Yeah, 60 or older.
60 or older.
Okay. Is the recommendation, that's all the research they did is based on that. Not that somebody at 20, 30, 40, 50 doesn't benefit, but it's tailor-made for that.
Sure.
And then have an Oshkosh zip code. And that's really what it takes to get enrolled. And as you mentioned, it is completely free. Hard to believe that price, no strings attached. But you're right. This is something that we're very proud that we can offer the community at no cost. That through some of our falls fees that we've discussed on previous shows, that's what funds that, so that we can bring that to our community free of charge.
Sure.
I knew we were going to be talking about this tonight, so we've been closely monitoring our progress. And as of today, we're at 394 people signed up.
Wonderful. Well, I'm one of them. I will say that.
Fantastic, and I appreciate that. So hopefully people watching this, listening to the show, will get inspired and sign up and push us over that 400 mark this week.
That would be great. And this will be online tomorrow, and it'll start airing locally next week. But let's hope that we can push 6 more people through to this. And I want to talk a little bit more about it, but on average, Chief, how many calls is the Oshkosh Fire Department getting? Whether it's per week, by month, by year, for falls?
We're right about, you gave that statistic about the 18% of calls across the nation, and we're right there. It hovers right around that 18% mark for us, which works out really well for somebody that's not good at math like me, because we run about 10,000 calls a year. So it's about 1,800 calls a year that we're responding to. Yeah, and by far our leading call type.
Yeah.
Very, very disproportionate, and that's why we've put so much work around this and so much effort into fall reduction, because, as you said, it's preventable. In many cases. So how can we prevent that from occurring?
Yeah, and get that number greatly reduced from 1,800 down to something that's, I mean, one is too many, but if you can just get it reduced greatly, that's a big help. I don't know personally these people, but I personally know of 3 people in my circle of friends and their family members and so forth, 3 people in the last year who have not just fallen, but who have died from falls in their homes. And it's shocking, one of them was someone that I grew up with, was her sister. And it's shocking when I think about the number of people that I personally have known of who have not just fallen, but died. And I mean, do you see that pretty frequently where there are deaths?
We do. As you mentioned, Wisconsin is the leading state in the union, and we work closely with the county coroner to get the information about deaths. So the ultimate tragedy of a fall that leads to death. That's why we don't want that to happen. And falls affect us all. That everybody that we talk to, a sibling, a spouse, a parent, a grandparent, they've got a story about how a fall was basically the demise of their lifestyle and sometimes their life. That was the mitigating factor that led them to not be able to live independently anymore, to have to move from a home so that they didn't have stairs, to lose their life. That it's so impactful to our community and has so many effects, not only financially but emotionally, that it's a tremendous risk that we've got to address.
Yeah, I'm going to be showing my age here now, but that's okay. I believe, and don't quote me on this, anyone, but I do believe that an old-time actor by the name of William Holden, I'm sure you know who he is, but I believe that he died many years ago because he fell and hit his head on the corner of a table in his home. And sometimes things in life happen and we don't think too much of it until all of a sudden somebody famous it happens to, and then we think, oh geez, kind of brings it home a little bit more because for whatever reason this famous person is relatable to us in some way or whatever the case may be. And so it's unfortunate that anyone passes away, but sometimes someone famous, it does draw a little more attention to things. Of course, that was many years ago.
Right. But to your point, I think if people view it as if it can happen to them, boy, it could happen to me.
Sure, yeah. I mean, because here's someone who was, he came from the golden age of acting, and he was in so many movies, and he did so many things for animals, like in Africa and Zimbabwe or someplace like that. I mean, he had a lot of things in place for animals and saving them, and yet he couldn't save himself in the end, but maybe could have had he known about some of these statistics, or we had a Nimble app back then. So is there anything more that we need to know about the app? We've got a sheet that I'd like put up here as we've been talking about this. This is something that you actually sent out to the public. Did this come out in a water bill, or how did this come out?
We inserted it into everybody's water bill that they received at home. We've done social media campaigns, we've done literature drops where, it's at places where somebody 60 years or older may go, like the senior center, the YMCA, the library, the museum.
Sure.
That's, and we've been doing it long enough now that we're starting to get measurable results. So one of the things that when you talk about, I got to use an app and is it free? Well, yeah, not only is it free, but one of the measurements I got back today is that 81% of the people that use it say they'd recommend it to a friend. And that's a pretty high satisfaction rate.
Yes. Yeah.
Other feedback we've heard is, seriously, older people aren't good at technology, and that is a fallacy, an absolute fallacy. many older adults are very good at technology, have embraced technology, and what's important is this app was specifically researched and designed and created with them in mind. So, the epitome of user friendliness.
Yeah.
So we think that's really good. And what we're seeing is, longitudinally, improvement. Because you do a routine, you do an initial assessment when you sign up, as you know, and then you routinely will do periodic assessments. That the improvements that we're seeing are akin to going to physical therapy 2 to 3 times a week. The same outcomes, the same benefits.
Wow.
So, we are seeing improvement of strength and conditioning and core strength, balance, those things in the user. So, obviously when we're piloting this program, we want to make sure it has good results, and we're really starting to see those great results.
Sure.
We're seeing people engage with it, use it frequently, that they don't just sign up for it once, try it, and go, they're coming back and visiting, and engaging with it, on average 2 to 3 times a week.
That's wonderful. And again, all it really takes is 10 minutes a day. And that's both for physical and cognitive, health. It says that balance training improves coordination, which then that plays a major role in fall prevention and fall-related injuries. And it says that you can do these things whether you're seated or standing. So if someone has mobility issues, let's say maybe they use a wheelchair frequently, but they're not necessarily confined to it. This is something that they could do from their wheelchair if they wanted to?
Correct.
Okay. All right. Very good. What else do you think that folks need to know about this Nimble app?
I'd like to share a couple things about access.
Sure.
I talked about 211. Also, if you go to our website, www.OshkoshFD, like firedepartment.com, right on the top there's a banner, the top banner, there's a tab, falls prevention. You click on that, it'll take you to what's called a story map. And it has all the resources about our partners. It's got the links to get to Nimble, has information and data about falls and the falls that we've responded to, the numbers from the coroner, and really tells the story about falls and fall prevention, and is a resource, and a repository to get you into that pipeline again, like I said. So if you can't remember the 211 or the Nimble website address that you shared, that'll get you there as well.
Sure.
And then another program that we're really excited about, because like I said, we want to, I look at it as like a cafeteria plan. Let's put as many things on the menu as we can, as many options and solutions. So we did some research around a program called Bingo Size. It's a nationwide program. It has really great results. And as the name implies, you couple bingo with exercise. So that same concept of doing standing seated exercises in between the bingo calls, also associated with bingo, you have to have prizes. So you have an opportunity to win prizes that are fall prevention related. So it might be grippy socks, it might be night lights for your to illuminate your walkways, things like that. And we've partnered with the Senior Center to make that happen. They've gone through all the training, and they're getting ready to roll that out in the next few months. So we'll everybody keep an eye out for that bingo size opportunity. They were already doing bingo, very popular attraction at the Senior Center. So I said, let's dovetail off that success. So like I said, we're always researching and looking for new ideas, new options to try to capture people's interest, and commitment to find fun ways to reduce falls and prevent them.
Sure. So let me throw this out here, Chief. People from all around the country watch this show. If there are folks elsewhere, obviously they don't have an Oshkosh zip code. So they really can't use this app, right?
They shouldn't.
Okay. How could they go about getting this app?
Well, and when I said they shouldn't use our zip codes if they don't live here, right? But Nimble is based in Colorado. That's where their headquarters are and where they've got their start. So I know that there's an organization there called the Denver Regional Council of Governments that funded that so that everybody in that Denver metropolitan area can use it. That there's different options through Medicare, Medicaid, healthcare systems. And that's where they've spent a lot of their time, and where they occupy the most space is through healthcare systems and health insurance. So we're trying to look at how can this be a solution in the public safety realm. But there are other opportunities around the country. So going to that Nimble website, we'll have more information about who's eligible, wherever you might live across the country.
Okay, that's wonderful. And I'm going to be watching for this bingo size thing also. I also want to mention another program, and this is something else that's put out by the Winnebago County Health Department. And we've talked about this in the past when they've been on the show, but I want to bring it up again because let's say someone they don't have a smartphone, they don't want to use a smartphone, they don't want to use apps, they don't want to use technology. The County Health Department does have, it's not quite like this, but it is another program that is designed to help prevent falls and give people greater stability and so forth. It's called Stepping On. It is a 7-week program. It's 1 2-hour, I don't like to use the word class, but it's
Session.
There you go, 2-hour session once a week for 7 weeks. And I know that the County Health Department does these in different locations, so all you'd have to do is just go to the County Health Department's website and type in, do a little search for Stepping On, and you could find it. And it has been researched and proven to reduce falls by 31%. And that's cutting this in a third almost, basically. So those are some pretty impressive numbers. So if Nimble isn't for you, maybe Stepping On is. But I would encourage folks to do something rather than nothing. It certainly can't hurt. Mm-hmm. Anything else about falls or fall prevention before we move on to our next topic?
I just definitely appreciate the opportunity to spread the information, because it's all about awareness, right? Mm-hmm. And about making these people aware of those resources are out there. And you have been a huge ally and asset. I've been on the show multiple times over the past several years talking about falls, and it's people like you that are helping us champion this effort that are making the difference.
Well, thank you.
So always appreciate that.
Yeah. And I was doing this and promoting this on you guys' behalf before I even hit my 60s. But but now that I'm in my 60s, it's even more important to me now.
Yeah, all of a sudden it's me, right?
Well, it's hitting home more now.
Right, yeah.
For sure. So, we always like having you guys on. I just love it. And, because there's always interesting things that you guys are bringing to the forefront that people can benefit from. And that's what we all need, really, is we need to be focused on more and more things that can benefit us. Mm-hmm. Okay, great. Well, then let's talk about something else now. We're taping this on the 11th of July. I know some of you will be seeing this after July 15th, but on Monday, July 15th, it is National Pet Fire Safety Day. It takes place every single year on July 15th. This year it happens to be on a Monday. And it's a day that is set aside, to try to educate people on how to keep their pets or pet safe in a fire. And it doesn't matter what kind of pets. Most people have cats, dogs, rabbits, that kind of thing, but it can be any kind of pet. It's interesting because our pets, not only can we trip over them, even though they're not intending to trip us, but pets sometimes cause fires. A candle gets knocked over by a cat or a dog. I say cat because cats tend to jump up on things where candles are sometimes. So what are let's just give us a laundry list of things that people should be aware of when it comes to pets and pet safety, and how they can help keep their pets safe.
Yeah, absolutely. I'll take initially a little diversion from fire safety, but it's getting warmer every day. Right? It's summertime. So not just thinking about fire safety, but thinking of overall pet health and wellness and safety. Don't leave them in cars.
Oh, God, yes.
Make sure that they have water available to them. That they're staying hydrated, just like we need to stay hydrated. So think about those heat-related emergencies. Sidewalks getting hot. Asphalt getting hot. Think about you don't want to put your bare feet on either, do they?
Yeah.
Specific to fire safety. That I was reading through some materials earlier today to be ready to talk to you. I know the answer to this, but for the benefit of the audience, Cheryl, do you think pets are part of the family?
Oh, I absolutely do.
Right. So the recommendation was, that the sage advice was include them in the family plan. We always advocate for your family, your household, to have a plan of how we're going to evacuate. We're going to know where medications are in the event of a disaster, not just a fire. That medications, health records, information, things like that. You plan for that. You should include the pet right in that same plan. The same things that I would tell you to prevent a fire, you causing a fire. I said many of those things are the same exact things. Especially they're very similar to children, right? Because many pets are just like a child.
They are, yep.
So having those flameless candles that you talked about, infinitely safer. Turning handles on the stove inwards so that they can't jump up and hit that handle and dump scalding water on them either, or because you're there. That's knobs on the stove. That it is not an altogether uncommon event for a cat to get up on the stove or bat at those knobs, even or a dog jumping up there to turn that burner on.
Yeah.
So you may want to take the burners off the stove.
Interesting. Okay.
Extension cords. Not unheard of for an animal to chew on an extension cord. Might be a dog, might be a rabbit. It might be any variety of pets. So
could be a mouse you end up having in the house.
Right. A pet you hadn't planned for,
right.
or is aware of. So thinking about all those type of things, that if you kennel a pet or have a bed for a pet at night, put that in the path of exit so that you can grab your pet on the way out the door as you're exiting. That having some of that forethought in your planning process, and making it easy for you to do those prevention steps, goes a long way towards that pet safety.
Sure.
And then importantly, for whatever reason your pet gets out, you'd want a collar on it, right? So it can be returned to you. Well, typically, people always ask, and you've asked me in the past, what happens, what do pets do in fires? They're smart like you. They want out. They find their way out. So now they're out of the house. And generally, we always tell homeowners they're probably going to come back on their own volition. But if now your dog, cat, pet, whatever type of pet it is out on the loose because of that fire, you want to have it able to be returned to you. So having that collar and ID on it, or having it chipped, absolutely.
I'm going to make a plug for chips, as you just mentioned, because sometimes dogs slip out of collars. I work anyone who watches this show or knows me knows I do a lot of volunteer work with animal rescue groups and welfare groups. I can't even begin to tell you how many times I've heard of or seen personally dogs slipping out of a collar. Mm-hmm. One of the ones that happened here in this county, I won't mention his name, but he was an elected official. He'd been an elected official for many years. He had this beloved dog, and that dog happened to bolt out of the door when someone came. I think it was a delivery person or something. Mm-hmm. But the dog got out. It was winter. The dog either slipped out of its collar or for whatever reason did not have it on. And sadly, the dog went through he went through ice and he drowned, and he eventually, the dog was found. I don't know I can't remember if it was a he or she, but it was a very, very sad situation. And this is a man who was, extremely well versed in pet things, but stuff happens, and it can happen in an instant. And sometimes we don't even have time to think about. This is happening, you know. I mean, I won't even go to my front door often enough and answer the door unless my dog is behind a gate, you know. And even then I sometimes worry, because what if she pushes her way through the gate, you know. So fortunately, I think most of us have other doors, you know, that we can have people come to, so that if the dog gets out, in my case, they're in a fenced yard, you know. But I think microchipping is a wonderful thing. Okay, so and making fire prevention folks, fire department people like yourself, letting you guys be aware of the fact that there are pets in the home. What's the best way for folks to do that, Chief?
You know, several ways. You know, several things that are going to be of interest to us. You know, so one is, you know, I believe you have them at your house. You know, that, you know, most people are familiar with that, the decal, you know, on the door of, you know, pets inside. You know, when we arrive on scene, you know, let us know. You know, 'cause we're going to conduct a search. So I've got how many dogs? What level are they? You know, are they kenneled or behind a gate? You know, and keeping them, you know, putting kennels and cages and, you know, isolating them in a room with a gate close to a door. You know, that's going to allow us to get them much faster. If you, when you come in that door, grab that kennel, that cage, you know, and pull them right out of there, lowers their exposure to heat and smoke. You know, so those are all things that you can help us do, you know, and help make it faster and easier for us to access that pet, you know, to have a better outcome.
Sure. I know people can buy decals. If you make a donation to a certain place, you'll sometimes get decals in the mail. Do you guys have decals at the fire department?
We don't.
You don't,
You
okay.
know, and even, like I said, you know, does it have to be an official decal? You know, print it off on your color printer at home and put it in the window.
Yeah,
you know?
except then it could fade over time
Right,
or whatever. But I mean, unless you're going to laminate it somehow. But and to that point also, you know, then if the number of pets in your household changes, you should update that as well, so that a lot of valuable time isn't spent by folks like yourself looking for an animal that is no longer there.
Yeah.
You know.
And one of the things I would emphasize, you know, because I know you view your pets with a lot of love. You know, think of them as
Absolutely.
children. You know, many people, you know, these are my fur babies. These are my children. When we arrive on the scene of a fire, don't tell us your child or your baby is inside, because that's a very different search. You know, it doesn't minimize the sentiment, but a baby I'm going to look for in a crib.
Yeah.
You know, the baby is not as mobile. You know, it's going to be in different locations. You know, that I need to know what I'm looking for, because where it probably will be and what it will feel like when I find it. You know,
Right.
so if I'm looking for a child, you know, that's a very different recognition pattern than a cat.
Absolutely, because a child is probably not going to go running and hiding, especially if it's a child in a crib, or in a playpen, or wherever the case may be. Whereas a pet, a dog or a cat, you know, might go hiding.
Yeah, it's going to fit right under the couch. You know,
Yeah.
normally I wouldn't look for a child under that couch, but
Yeah.
you know, I can quick sweep my arm underneath there and find that pet. And like I said, increases the chance of success. So like I said, no way, you know, putting value statements on it, but give us that clarity of what
Sure.
am I looking for.
Yeah, I do think that pets quite frequently will hide under a bed. You know, when I was a kid growing up, our house was hit by a tornado, and I had just left the house a few minutes before it hit, and this was back in '74, and my brother's fish tank, you could not tell anything ever happened to the house. The dogs must have hid under the bed or something, because they were still there. I mean, fortunately, the house wasn't demolished in its entirety. That would have been a different conversation. But they must have been hiding under a bed somewhere, because they were perfectly fine too. So,
Yeah, they have pretty keen survival instincts, you know, so they recognize danger just probably much better than we do, around fires.
They probably sensed the tornado was coming, even though nobody else in the city of Oshkosh knew it was coming. That was much sooner before you came arriving here on our scene. But, because you've been here now, what, about 10 years?
No, just past 6 this last month.
Wow.
Yeah.
It just seems like I've known you a lot longer, I
Right.
guess. And that's not a bad thing. But, yeah, so this happened in April of 74. And, we didn't have early detection then or anything like that. I mean, it was a beautiful day out. Nobody knew anything was going on. And until we saw things up in the air, we're like, what is that?
Yeah, why is a cow flying?
Yeah, it's parts of our home,
Yeah.
So, but the dogs, I think that they do, look how they sense storms that are coming. Mine will start taking off and hiding a little bit, and then I'll get a weather alert on my phone, so. All right, well, let's move on from that. We want to talk about Fire Prevention Month and Week, since I may not have a chance to have you back again before that happens. And I know we've got some things that we can pull up for this. October, of course, is Fire Prevention Month, and the year is going so fast. It's going to be here before we know it. But Fire Prevention Week this year is October 6th through the 12th, and the official theme this year is smoke alarms, make them work for you. And we have a little graphic. There he is. There's Sparky, the fire dog. He's the Dalmatian. So let's talk about smoke detectors and smoke alarms. I guess they're the one and the same, and people use them interchangeably. But, we need to, everybody, I don't think anyone is ever too old to be told about fire detectors, smoke detectors, whatever you want to call it. And that they should be changed out. The batteries should be changed out on a period. They should be tested monthly, and they should be changed out. If you want to really be safe, change them out twice a year, right?
Change your clock, change your batteries.
Yeah.
That's a big national campaign. So at daylight savings time, when you're going around changing all the clocks, change all the batteries as well.
And I sure wish we could get away from changing those clocks.
Right.
Because I just think it's so ridiculous. But it's interesting. I pulled a couple stats here. Having working smoke alarms in the home reduces the risk of dying in a home fire by more than 54%. And roughly 3 out of 5 deaths occur in homes where there was either no smoke alarm or there were smoke alarms but they weren't working. One of the things when I was a landlord, I would grill my tenants constantly. Don't take the batteries out. If it's beeping, call me. I will bring you a new battery, because that's something landlords may not know, but it is their responsibility to be providing batteries for those smoke detectors. But don't just take it out, because if you take it out, you're going to forget that you've taken it out. And then they don't do any good if they can't work, right?
Absolutely. Smoke detectors save lives. People taking the batteries out, leaving them out, that's an issue. And also, put it back. When you change the battery and you set it on the kitchen counter, and I'll get to that eventually, that's not how it's designed to function. It needs to be up there on the ceiling, because that's where the heat and smoke will rise to. So, being diligent not only about changing the batteries, but also reinstalling it. You talked, I kind of giggled when you talked about getting rid of daylight savings time. Well, we've been able to get rid of a lot of the changing of the batteries. That now when you purchase smoke detectors, they've got an intrinsic battery that's good for 10 years. That way you don't have to change it twice a year, and you won't have to hear that chirp quite so frequently, so that people can't take the battery out and not use it. It won't let you. So a lot of new benefits in the technology to make that happen. It's so important, because you talked about those deaths. People are under the impression, the misconception that smoke will wake you up. Smoke will not wake you up out of your sleep. You may wake up once you can't breathe, or you may wake up because it's really hot, and by then your survival profile has gone down immensely.
Yeah.
You need that early detection to have the chance to exit, to get you and your loved ones, your pets, the things you care about, out of that house but before the fire grows in size and intensity.
Sure. And I'm going to bring up what you have said so many times on this show. It's not necessarily tying in with smoke detectors, but sleep with our bedroom doors closed.
Yeah, close before you doze.
Close before you doze. And remind us again why we should do that.
You know, it is remarkable, and they're doing a lot of research nationally around, in collecting data about rescues and survivability after fires. Not only tracking fire fatalities, but saves. And the Oshkosh Fire Department was one of the first in the country, and certainly the first in Wisconsin to embrace this and participate in this firefighter rescue survey. When you look at the pictures from one side of the door to the other, you see these, this horrific scorched damage, and then a fairly pristine environment on the other side of that closed door, and people are surviving. That what people would think is a fully engulfed structure that's burning out of control, they're surviving because they're behind that closed door. Mm-hmm. So close that door when you're going to sleep, and if even in the daytime, if you're awake, the house is on fire, you can't make your escape, get in a room and close that door. Increases your survivability. We'll come get you. We'll initiate that rescue, but just getting behind that closed door immensely, exponentially increases your safety.
What if you have, and I'm thinking of a few different homes that I know of, mine in particular. I mean, you've got a door very close, an exterior door very close to your bedroom. I mean, first of all, I fear that if I close my door, and I think a lot of people probably feel this way, we're not going to hear that smoke detector. Mm-hmm. Well, I can guarantee those things get so loud and so annoying, you're going to hear them.
Right.
And if you've got a pet, they're going to hear them because they hurt their ears and they're going to be pawing at you. Mm-hmm. So you're going to be notified. Mm-hmm. But my first instinct, and I'll be the first one to admit it, my first instinct would be, if my smoke detector goes off and there's smoke that I can smell in the house, I'm grabbing those pets and I'm out the door. Mm-hmm. I am out the door because it's right there. Mm-hmm. But not everybody has that ability, So I think it's important for them especially to, like you said, close before you doze.
Yeah, when you're going to make try to chance that exit, feel the door. The door is hot, don't go through it. Or when you open the door, you see fire and smoke between you and that exit, shut it.
Yeah.
So evaluate, and assess that opportunity to get out, because certainly the most prudent thing to do, grab up the family, whether that's 2 legs or 4 legs, and get out.
Yeah.
Get out of that structure, but sometimes that's not always possible, that our egress path is blocked by the fire. So then can you leave through a window, or stay behind that door, so that we can come get you?
Mm-hmm. I just had something on my brain, and it's gone. Talk about Alzheimer's disease here. Alzheimer's disease. I just was thinking of it, and it's just gone, just like that. But let's talk about. How many fires would you say on average you guys respond to in a year's time where there are no working or no smoke detectors, period?
It's about a third to 50% of the time. Because
wow.
that's one of the things that
so you're
we document.
Kind of right in there with those national statistics once again.
Yeah, and we've done the data analysis, and it absolutely matches the statistics you're talking about as well. That no smoke detector, the fire damage is much higher. So not only does it save lives, but it saves your property. Mm-hmm. It's just a straight line up for, no detector, no systems, that versus having those, how much property damage occurs too. So that early notification only may save your life, but may save your stuff.
Sure. Now, I know in rental properties this is state law, but I don't know if in your own home it's law. But the law for rental properties is that you must have a minimum of one smoke detector on each floor of the home. And if it's a big home with, spread out over a few thousand square feet or whatever, you might want to have more than one on each floor. But is that also, is that a law in your own home as well?
It is not.
Okay.
Yeah, highly encouraged. And that's why we do the detector trek, which we'll do again this year, where we canvass a neighborhood and make sure that you have smoke detectors. If you have smoke detectors, they're working. We'll change the batteries. Like I said, we'll install free smoke detectors. That, and as you mentioned, it is legally the landlord's responsibility. But that's not the nuance that concerns me. If you don't have a working smoke detector, you don't have a landlord who may be as vigilant as you were, we're gonna install a smoke detector for you. You call the fire department, you come by the fire department, we're gonna make sure that you have a working smoke detector. Other ancillary services we provide too, or how we reach the broader community. You and I have the benefit of hearing that smoke detector. But if you're hearing disabled, or have hearing loss, it's a whole different detector. We have those available as well, so that
really,
yes.
Okay, that's really good to know. So, what kind of, just out of curiosity, what kind of detector is it?
That's there's a couple different ways that you can implement it and utilize it. Some light up, so it's a big flashing light that's going to get your attention. Others will vibrate the bed.
Okay.
So that vibration will wake you up and make you aware that something's going on.
Okay.
So we also recommend carbon monoxide detectors. It should go hand in hand. That's the silent killer because you can't see it, smell it, taste it.
Right.
So make sure you have working CO detectors in your home as well.
And those are required for landlords also. It just never ceases to amaze me how many landlords they think, I'll just get in the business of having some rental property, get some nice income, and they don't think about the responsibilities that entails. Someone is placing essentially their life or their family's lives in your hands, and you damn well better take that responsibility seriously, because it's not just it's a tough way to earn a living.
Right.
If you're doing it as a full-time thing. It's a tough way to make any kind of money, but if you're doing it right, and I would think that they should be. All right, we're quickly running out of time here. Just a couple of really quick fire summer safety tips, because I know people are out there grilling and so forth, and we hear about silly things that people are doing, like throwing certain types of accelerants into the fire to make it bigger, better, brighter, whatever. These are not smart things to do.
Yeah, or safe.
Right, yep. But give us just a couple of quick summer safety tips.
It's a big thing, don't ever leave something unattended. Whether it's a charcoal grill, a gas grill, a recreational fire pit, to make sure you've got eyes on that fire. Don't leave it unattended. For a variety of reasons. Keeps loved ones out of it. Keeps pets from potentially getting into that fire, and reduces the chance of you starting your house on fire.
Sure.
Keep those things a safe distance away from the home. Don't do it inside your garage. If it's a rainy day, don't move your charcoal garage into the grill, or your smoker. That's and having an ability to extinguish that fire or that grill. Have a fire extinguisher present, or the garden hose present.
Or so some dirt.
Yeah, some dirt. To be able to extinguish those mishaps that may occur. And then, as you mentioned, certainly do not use lighter fluid and gasoline and other types of combustible accelerants, like you said, to try to enhance or help start the fire.
Sure. Okay, we're down to just a couple minutes. Any closing thoughts?
that appreciate the opportunity to help
of course.
talk about how to keep our community safer, whether it could be around falls or fires. That I hope everybody's able to have a happy and safe summer. And as we move into fire prevention month, look for us to be doing those detector treks and being in the schools, and promoting fire safety education.
Sure, and I'm going to try and get you back on, even if it's just for like a half an hour, since we've kind of now covered some of this stuff. Even if it's just for a half an hour, when it gets a little closer to that
That'd be
time.
fantastic.
If I can find a way to kind of finesse my schedule a little bit. Okay, wonderful. Before we wrap things up, I want to just, I have this here, and I know we've got a graphic of that we can bring up on the screen. In our water bills recently, there we go, there was a one-page, double-sided information thing here on preparing your pets for disasters. Kind of some of the stuff that the chief and I have been talking about tonight. And it really goes into a lot of detail, not stuff that we could necessarily cover here tonight, but a lot of things that we have talked about already. But I just want to thank the city of Oshkosh for whoever took the initiative to put this in the water bills. I think really deserves to be applauded. And this is something that was put together by ready.gov. And so if you're watching this in an area where you wouldn't necessarily be getting a water bill from us, from the city, and you'd like this, you can go to ready.gov. And I think it's ready.gov/pets. There it is. It's on your screen right now. And for people listening to us on the radio, ready.gov/pets. Or you can also go to the Humane Society of the United States website, hsus.org, and do a search for disaster prep, and it'll come up with the same kind of stuff. But whatever it is, whatever method you're going to access this information, please do something, because it's better to have prepared for things and not need them than to need them and have no clue what to do, where to start. And things have to happen in a hurry. I mean, we look at what's going on in Houston right now, for example. Galveston also, but from having lived in Houston, I know what a mess that can be. And for people who I still know down there, I mean, my thoughts and prayers are with all of you folks, because it's not a good thing. But disaster can strike in a moment's notice, or you can have several days' notice, like folks have in the event of a hurricane. But it's better to have a plan in place and not need it than to need it and not have it. So that's my speech on that. So on behalf of the chief and the entire Oshkosh Fire Department, I thank you. I encourage you to do something. Thanks for joining us. Thanks to the chief for joining us. And thanks to my crew. And of course, thanks to you for listening and or watching. So we'll see you next time. Until then, take good care. Keep your eye on us. We've got our eye on Oshkosh.